So if your bones are a little weak, you fall, you break your hip. The most common areas to break are your hip, your back, or your wrist, and those are the most common types of fractures. We call those fragility fractures or osteoporotic fractures, and those can sometimes cause a lot of issues, especially if your bone density goes down. If your bone density goes down when you're older, then you become osteoporotic, or you become something called osteopenic. So osteopenia is not quite as bad as osteoporosis, but it just means an overall decrease in your bone density and your bone health. So we'll do different things. We'll sometimes supplement with vitamin D. We'll sometimes use, if it's really bad, something called bisphosphonates. We'll give calcium. And sometimes vitamin D can even be as high as 50,000. It's measured in international units, so IUs of vitamin D if it's really, really low, like a vitamin D deficiency. Just had my ortho appointment for bilateral osteoarthritis in my knee, got steroid injections. Did you get them in both knees or just one knee? You have to drop 40 pounds before surgery. If you tell me your height and weight, we could calculate your BMI. Okay, looks like you already got it. BMI is 44. I would say, for a knee, it depends. It depends on, age, comorbidity, other factors. Obviously, the best thing you can do is try and get down to a BMI 40. Now, some people have a really hard time getting down to a BMI 40, especially if both your knees are really arthritic and you have a lot of pain. So that can sometimes be a little problematic, and it can be really hard to sometimes get that weight off. Definitely, I recommend either doing it naturally. Avoid having bariatric surgery, because if you have bariatric surgery, they basically make your stomach smaller. And then sometimes you need chronic or long-term supplementations, like vitamin supplementations. Do you have any information on the spine? Yeah, I have a lot of information on the spine. I mostly do, I see all the chats from YouTube and TikTok, so I'm live on both right now. So if you guys have questions either on YouTube or TikTok, drop them in the chat, and I'll go ahead and answer them. When should you see an orthopedic doctor for hip pain and failed physical therapy? So if you have hip pain that's causing a decrease in your overall quality of life, if you're having difficulty with things called activities of daily living, meaning you can't go to the bathroom without pain, go upstairs, walk on uneven ground, just putting on clothes causes a lot of discomfort. So when quality of life and activity daily living are affected, that's when you should see an orthopedic doctor. They can get an x-ray, they can rule out arthritis and a lot of different things. Both my knees feel like they have Rice Krispies in them and they crunch when they bend. We call that crepitus. So crepitus is the crunching in the knees. It can be due to a bunch of different things. One is if you have a lot of inflammation from arthritis in the knees, then you get something called hypertrophy, which means the tissues around the knee, the capsule, the synovium, they all become very thick and inflamed. And if things are thick and inflamed in the knee, then they start to crunch and make some cracking sounds. Now, a level of crunching can be normal in a knee, and that can be, my knees crack when I move them, so it's not, it doesn't mean you have to do something. When it's associated with pain or you have dysfunction with that issue, then it can become a big issue. Why do knees pop? Same thing, because the capsule gets inflamed. Yep. And it rubs. That capsule can rub on different parts, and that kneecap, as it bends, can pop over either the femur bone or pop over some of those thickenings in the capsule and create a popping. I had a manipulation under anesthesia, but my knee is only bending to 90 degrees. Should I have another? Usually, if you can get to 90, then we're not doing a second manipulation. There's a procedure called a lysis of adhesions, meaning we will go in there with a camera and try and clean things up, but that would be at least 3 to 4 months, probably 3 months after your manipulation, and then the final treatment is a revision surgery. I think I broke my toe. How do I help it heal? Well, a lot of times if people break their toes, we'll put them in boots, with vitamin D, calcium supplementation. Usually most toe fractures will heal on their own. It may be helpful to get an x-ray, just make sure it's not too out of place. If it's too out of place, then you would need a better, sometimes even surgery, but most toe fractures heal non-operatively. Hey, just had an arthrodesis with an external fixator today. Sorry to hear that. That's a big procedure. It sounds like they're trying to get your joint to heal together. Cause of rhomboid pain. There's a lot of different causes of rhomboid pain. It could be activity specific. If there's something in the shoulder. Frozen shoulder treatment. So a lot of the times frozen shoulder, we're doing like cortisone injections, which can be helpful. I had a knee replacement in March and now I'm experiencing calf pain. I have an ultrasound and it's not a blood clot. That's good. So whenever you have calf pain, the first thing we always want to do, we want to rule out a blood clot. If it's not that, then you're not that far out. You know, you're still probably healing. The muscles can take a little while to heal. So people improve after knee replacements, even 6 months to a year. I was just promoted in orthopedics. That's great. Do you know much about lupus? I do know a good bit about lupus. I do treat a lot of patients with autoimmune diseases and lupus conditions. Autoimmune attacks the joints, so that can be really painful and cause the cartilage to break down because the antibodies destroy the hip. Any experience with bilateral hip replacements on young patients with dysplasia? Yes. The other week I just replaced a 22-year-old's hip because of dysplasia, meaning the socket didn't form right. Thank you for all the follows. Thanks for all the double taps and subscribes. I really appreciate it. Type 1 diabetes. Diabetes can really affect outcomes for everything. It can affect the nervous system. It can make you more prone to infection. So make sure you keep those sugars controlled. Most type 1s, I'd say type 1s usually do a better job of controlling their sugars than type 2s do. How long till I can drive after, sounds like your right total knee replacement. So I let my patients drive about 2 weeks after their knee replacement operations. Now, that's my clearance as long as they're off narcotic medication and they feel like they have appropriate muscle control. But most people, I would say, probably go back to about 3 to 4 weeks. The most important thing about driving is being able to hit the brake in time, meaning not brake time's the most important thing. Do you work with mid-levels? Any advice for an expiring PA? Yes, I work with mid-levels. I have a physician assistant. Her name is Kelly. She works with me in all my surgeries. Very helpful. She also sees patients and has her own clinic hours as well. And so she really enjoys doing that, but she's very helpful in all the surgeries. How long after surgery should the numbness in my calf go away after having hip surgery? It's hard to say. If it's been there from day one, it depends if a nerve was affected, but you can heal, and nerves may even take a little bit longer to heal, even 6 months to a year. That drug is not safe, so I would avoid that drug. So there's no recommendations on that. I had a quad spinal fusion. How long should it take to fuse? The bones can take, everyone's variable. I will say if you have good healing potential, it can take 2 to 3 months for those bones to heal together. Is CPM a good way to recover after total knee? I do not use CPM. There's literature to support that you don't need CPM to recover from a knee replacement. The issue is just bend it at first. That's at the very beginning. The CPM machine, it's just like, it's a lot of motion, a lot of trauma immediately after the operation, so we're not doing that anymore. I have a full rotator cuff tear with mild pain. Is it worth it having surgery? Most of the time for rotator cuffs, we're treating them conservatively. We'll sometimes do a cortisone injection. Surgery is the last option if everything fails. Doc said he can't perform a knee replacement surgery for 90 days after my injection. That's a standard recommendation. There's a theoretical increased risk for a infection if you're doing a injection immediately after. If you're doing the injection immediately and then doing the knee replacement right after. So we try to wait about 3 months or so. Hello, sir, from India. Hey, what's up? Welcome. Welcome to the live stream. Can an MRI misdiagnose an ACL rupture? Yes, MRI can misdiagnose things, and MRI is not perfect, unfortunately. Tests in medicine have something called specificity and sensitivity. It's how well they are, or how good they are at picking up different things. And so MRI is not perfect, but the best thing is going in there with a camera and looking for diagnosis purposes, but we're not always doing that. But most of the time in MRI, we'll see an ACL tear. Can you have a hip replacement a year after liposuction, it sounds like? Yes, you can. Not a reason to not do a hip replacement in my book. How long is rehab after rotator cuff surgery? Usually physical therapy will be for about 3 months. But it may be even longer. Everyone's different. It depends on how fast you're recovering. But that doesn't mean you make a full recovery in 3 months. From a rotator cuff tear, it may take a year to make a full recovery. I had a hip replacement 11 years ago, and now when I sneeze, it pulls and hurts. May be helpful to get a new x-ray, get a checkup. I have to have both knees replaced. Should I do both knees at once or at the same time, or should I wait? I usually if I'm going to do knees, I usually try not to do them at the same time. The reason is there can be a slightly higher complication rate. I may choose to wait about 4 to 6 weeks apart if we really want to do them that close together. But you may have a higher transfusion rate, higher infection risk, higher stiffness rate after. Where do you practice, Dr. Harb? I might need another knee replacement. I practice in Washington, D.C. and Maryland. I do have a lot of patients travel for surgery. There's a link in my bio where I do telemedicine visits as well. Is a partial knee replacement better than a full with severe OA at 51? If you have severe OA, it sounds like severe would be what would be arthritis in multiple parts of your knee. If there's arthritis in multiple parts of your knee, then we're usually not doing a partial knee replacement. What's your average tourniquet time for a total knee replacement? I'd probably say around 30 minutes or so for a tourniquet time. Is there a lot of pain after rotator cuff surgery? Yes, rotator cuff surgery is a big surgery. It's really the physical therapy you have to push through. That's the hard part. It's not so much the surgery part, but it's the pushing through the range of motion. How long have I been a doctor? Let me think. I think 9 years now. Why does my knee lock up when I stand up from a seated position? It's hard to say. One of the most common reasons for knees locking or getting that mechanical sensation could be a meniscal tear in the knee. Hey, what's up? How's it going, Dark Nebula? Nice name. Arthritic right knee, no relief from cortisone and gel. Synvisc shots might have the pain go from the right side to the left side. It's not uncommon, especially if you have an injury on one side, for the pain to actually shift to the other. Many people with arthritis have the pain shift back and forth between knees, and it's because you're usually using one side and compensating for the other side. So very common. Cortisone injections can sometimes help with that. Having a reconstruction surgery on the foot, should I still have pain after 8 years? 8 years is a long time to have pain. It may be helpful to get an orthopedic foot and ankle doctor. Thank you for all the follows, the double taps, the support. I appreciate it. What's recovery time for an ankle replacement surgery? It depends, how bad your ankle is and what exactly they're doing. I would say a good time frame is about 80% recovery within 3 months, and then you'll get stronger even 6 months to a year after the operation. I'm not doing ankle replacements. I send ankle replacements over to my partner. I have 5 partners. One of them's a foot and ankle specialist. I'm in private practice, so I do all the hips and knees for the practice, and my partner does I have a hand surgeon partner as well as a foot and ankle specialist. Any advice on rehabilitating an extensor carpi tendon? I've heard conflicting advice: rest, exercise, ice, heat. So, the reason there's conflicting advice is because everything can kind of be good. Thank you for the finger heart. Everything can have its benefit. So, obviously, immobilization can be helpful, but you don't want to immobilize for too long. So usually immobilization is very early on, and it's for a short period of time, just to get things to calm down. We may be even talking days to a week. And then we want things moving, meaning we want to get things flexible. We don't want things to get stiff. Because stiffness can cause more pain for you. So we want to get the tendons moving. We'll probably send you for some occupational therapy. Ice is very helpful for inflammation. If there's a lot of inflammation, ice can provide an anesthetic effect. And then heat is good for the muscles, meaning heat can help relax muscles and help you get more motion out of the hand, especially if you're stiff. Then heat can be helpful in that regard. So everything is good. That's why you hear conflicting evidence, because there's not one thing that's best. Thank you for all the hearts. I appreciate all the double taps, likes. Thank you for the follows. What can I do about bone spurs in my heel? Bone spurs in the heel are usually from an Achilles tendonitis back there. It means the Achilles tendon is inflamed. If the Achilles tendon is inflamed, it's going to create a bone spur. It's your body's way of trying to heal to make things stiff. Any suggestion for 3 hip labrum tears in 2 years? I'm 23. That's a lot of tears. If you keep tearing your labrum, you probably have something called FAI, or femoral acetabular impingement, which is technically a dysplastic hip a little bit. If you haven't had a hip scope, that may be an option if you keep tearing the labrums. The risk of tearing a labrum, which is the shock absorber of the hip, is you develop arthritis, and you don't want to develop arthritis. Why did you choose orthopedic surgery as your specialty? Oh, thank you for this nice cowboy hat and mustache. Why did you choose orthopedic surgery as your specialty? So there's a lot of things when you're trying to pick a specialty. You want something that kind of goes along with who you are. And for me, I had an engineering background, and I really enjoyed building things. And so I knew early on, you pick between going into medicine or going into surgery. So early on, I knew I wanted to do surgery. So I was making a decision between the surgical subspecialties. The other thing I really liked about surgery is that you were treating things right away, meaning it wasn't like you were treating cancer for a long time or trying to control a diabetes or a number. You were doing a procedure to fix the problem. And so that led me to orthopedics because, that's what you're doing. You're doing a procedure to fix the problem. And, specifically hip and knee replacement, restoring people's mobility, I think is one of the best things you can do. Someone who's maybe been a runner all their life and wants to get back to that, or who just can't do what they used to do. And so hip replacement and knee replacement is really rewarding for those reasons. Does Biofreeze work? Yeah, there's a lot of topicals that work. There's over-the-counter Voltaren gels. Some people will use capsaicin ointment. The topicals can be some anti-inflammatories. They can also provide a little bit of distraction, and Biofreeze can be helpful for a lot of people. There's a lot of different topicals that maybe not all of them have the best literature for them, but I do have people it worked for one, work for some people. What about HA for knees? The gel injections can work very well. They're I would say probably about anywhere from 30 to 50% of people get relief with a gel injection. It's not as good as steroid, but it's an option we have to delay things. How do I get rid of scar tissue on 2 full knee replacements? It depends how long they were done. If you're more than a year out and you have scar tissue there's probably not a lot of it's going to go away. You can work really hard on stretching. If the knee is super stiff, then the only option to get rid of the scar tissue would be a revision surgery if you're more than a year out. Why do my knees lock up after being seated for too long? Hard to say. That's a mechanical symptom. It could be a meniscal tear. It could be patella alignment. That's a very vague symptom. One of the things we do when we make a diagnosis, we look at your x-rays, we examine your knee. So from that symptom, it's not very specific. I feel like I might have a growth or something on my hip, but I've had a normal x-ray, chronic hip pain, failed physical therapy. Should I get an MRI? If that's the case, then that's really the next step is to get an MRI, maybe look at the labrum, look at the bursa, make sure nothing's going on there. How do I decide whether to do a knee or spinal fusion first? I would say the knee replacement is usually a little bit easier to recover from than a big back operation. So we're usually doing, if you asked hip or back, it's always doing the hip first. It depends on which one's worse and how worse. Is the knee arthritis bone on bone and end stage? That's an easier operation to recover from. And sometimes when people can walk better after having a knee or hip replacement, then they sometimes actually get some relief for their lower back. How do you get rid of hip flexor pain? So it depends why it's being irritated. Is it an activity you're doing? Is it an overuse activity? Why is the hip flexor pain there? There's different exercises you can do, modify your activity, some anti-inflammatories. Sometimes we'll inject the hip flexor tendon with a cortisone, but that's a rare thing. It depends specifically which muscle. Do grade 2 MCL and LCLs heal easy? Healing easy is kind of a relative term. Grade 1 is mild, grade 2 is moderate, grade 3 is fully torn and you need a surgery. So 2 is kind of in the middle. If you strain 2 ligaments as a grade 2, it's probably going to take a little while to heal. It may take like 3-4 months to really get back to probably 70-80%. Your knee may not be the same for even 6 months to a year. So there's going to be some recovery. How to strengthen your feet? You can do Achilles exercises. You can stretch out the plantar fascia. There's a lot of things you can do for the feet. You can work on what's called core ankle exercises, which work on proprioception for the ankle and the foot. What would you say one can do before 4 years of college? Well, if you have a little break, take a nice little trip. But if you're trying to prepare to get into medical school or anything like that, enjoy your time off. There's no reason to start trying to prepare for medical school ahead of time. What's the treatment for hip joint instability? It depends why you're having it. Many people with hypermobility or EDS have a hip joint instability. One of the treatments, if it's been going on a long time, the labrum may be torn. You could fix the labrum. If it's gone on even longer, then you have arthritis, then replacement is really the only way. The doc used glue and not pressed fit your total knee replacement. Any concern? No. Glue, which is cement, bone cement, is actually the gold standard for doing a knee replacement. It's been around the longest. It's a tried and true method. Most people are still getting cemented knees. Thoracic costovertebral joint causing pain and spasms for over a year. Sorry to hear that. Sometimes we'll do steroids for that. What are my thoughts on PAO? PAO is a rotational osteotomy of the acetabulum. It's called periacetabular osteotomy. If you're not having pain and dysfunction, then I would not get a PAO. PAO is for a select few patients who have dysplasia of the hip, who are symptomatic, who are very, very young. Most of the time, PAO can, if it fails, it can have really catastrophic consequences. So it depends on age, and sometimes in the right situation, the outcomes of a hip replacement can sometimes even be more predictable than a PAO, because a PAO is such a big operation. Your bone has to heal back together when you do a PAO. When you do a hip replacement, the implant is press fit into the bone, so you don't have to worry about bone growing to bone, where bone just grows to the implant, which is a lot easier. Is a Morel-Lavelle lesion more of an orthopedic surgeon or a general surgeon issue? What do you think? It depends. Most common area for Morel-Lavelle is kind of on the buttocks. Either way, I've debrided them. A general surgeon has debrided them. It's really about cleaning it out, because it's an internal degloving, meaning the subcutaneous tissue is kind of separated away from the fascia and the muscles, and there's a big pocket there for fluid which can get infected, and that's kind of the worst thing. Hey, what's up? Received a cortisone injection in a knee on 3/22 due to a meniscus tear. Doctor doesn't recommend surgery. My age is 58. Do you recommend another cortisone? Yeah, you can do another cortisone. That's safe. If you're really not better, or you're having any other symptoms and the x-rays don't look too bad, you could always get an MRI too, just to see, make sure. It depends what kind of meniscal tear do you have, and then why are you still having these symptoms 3 months later. It may be worthwhile to investigate that a little bit more. Do I do plantar fascia surgery? I do not. Plantar fascia surgery is a more rare surgery. We're not really doing it that much. It's not a good surgery to have a plantar fascia release. Sometimes we'll do cortisone injections there. There's some ultrasound therapy you can do on the plantar fascia. Really stretching, anti-inflammatories are the best method for that. I do have a partner who does a lot of foot and ankle surgeries. I send all my foot and ankle cases to him. Cortisone shots hurt really bad depending on where it's given. Like, for example, a cortisone shot in the plantar fascia is incredibly painful. Cortisone shot in the knee, shoulder, not so bad. What causes muscle spasms? It could be inflammation, it could be dehydration, it could be electrolyte imbalance. Swelling behind my knee, why? Hard to say. Sometimes people get Baker's cysts in the back of the knee, especially if they have ongoing knee issues. Opinions on bone cement. Bone cement's great. We've used it for a very long time. Back in the 1950s, when we started using bone cement, it was actually pink, and we took it from the dentist. But bone cement has been modified. Sometimes we use antibiotics in bone cement. It's a tried and true method of fixing implants to bone that works very well. Does a robotic surgery use cement? Yes, it does use cement. What's your favorite thing to do outside of medicine? Well, I do a lot of social media, but aside from that, I like to hike. I do like to travel a little bit. We've done some cool hiking trips, and we recently went to Banff National Park. We've been to Glacier. We're going to Ireland in August, so I really enjoy doing that. Medicine takes up and orthopedic surgery takes up a lot of time. I like going to the gym, trying to stay healthy. I've run a half marathon before, so I do have a couple hobbies there, but life is pretty busy working. Thank you for answering my question, doctor. I have a lateral meniscal tear in the left knee. Yeah, sorry to hear that. It's not, it sounds like they diagnosed that based on an MRI. So if they diagnosed that based on an MRI, yes, you could try another cortisone injection. If it doesn't work, or depending on how it looks on MRI, they could go in there with a scope, maybe try and clean it up, see if there's any arthritis. I have an inferior gluteal artery aneurysm. I was told this is rare. Have you seen this? No, inferior gluteal artery aneurysm I have not seen, but, I have seen, vessels do weird things, meaning, did it happen from a trauma? Maybe you fell really hard one time and that's what caused it. People don't usually just get aneurysms for no reason, but that affects a lot of your muscles and your hip, and so that can be a big issue if you're not getting appropriate blood flow there. What can you do for softening patella? So it sounds like patella chondromalacia is what you have. Protect the knees, give it a period of rest, anti-inflammatory, some therapy to strengthen up the quad and hamstring. Sometimes we'll do some stabilizing bracing for that. Hopefully it doesn't progress on to arthritis. How many gel shots can you get? There's no real number. I would say most people who are getting shots in a joint, usually by about their third to fifth shot, they're tending to back off a little bit and not get as many. So I usually will do them every 3 to 6 months for a patient who's trying to delay a joint replacement operation. But that's just me. But I appreciate all the questions. We'll get to a couple more of these. Best advice after hip surgery? Just work hard to try and get back to normal. Oh, thanks for this nice little crown. Appreciate it. Best advice after hip surgery? Work hard to work to get those muscles back. One of the difficult things after hip surgery is abduction, adduction, hip flexion, getting up from a seated position, trying to get off the walker, get off the cane. Depends if you had a replacement or some type of traumatic surgery. Recoveries, if you broke your hip, can be a little bit more challenging than just having a primary hip replacement. Thank you. Appreciate all the nice comments. How common is it to re-tear the same ACL repair? It depends what it's repaired with, but some grafts can even have about 3 to 4% chance of rupture. And so bone patella bone is kind of the tried and true graft that has the lowest risk of re-rupture. Suffering with back pain, 6 surgeries, spinal cord stimulator, still suffering. Any suggestions? I'm very sorry to hear that. Anytime the nerves get affected in the back, it becomes very, very difficult and very challenging to recover from those type of things. There's stimulators, there's TENS units, things like that, but anti-inflammatories, pain management, there's not a lot of good solutions if you've had all those issues. Why did you decide to live where you live now? Why didn't you stay in Louisiana? That's a really good question. So I went to LSU for undergrad and for medical school, and then I moved up to New York. At that point in my life, I didn't have any more family in Louisiana, so my family had moved to other parts of the United States, and so I did have some family in New York. I did a 5 years residency in New York. I matched into a hip and knee replacement program down in Charlottesville, Virginia. And so when I was in Charlottesville, Virginia, looking for a job at University of Virginia, I was considering a couple different places. I interviewed in Indiana, I interviewed in Chicago, Florida, Colorado, and it just so happened that there was an opening for a job in DC, and the job was pretty good. It's a private practice job. There was opportunity to really create a high-volume joints practice with a lot of outpatient joints, cutting-edge technology. They were building a brand-new surgery center. So there was a lot of options to a lot of options to do that. So that's why I got out of Louisiana. There's not as much opportunity in Louisiana as there is in a large metropolitan city like in Washington, D.C., the metropolitan area is 6.4 million. So it's a big area. University of Virginia is a really pretty place. It's unfortunate that Charlottesville got that reputation. That actually happened. That was a very unfortunate thing that happened, and it, the town is very nice though. There's a lot of nice restaurants. Their downtown is really booming. Oh, I wish you were accepted in Indiana. Yeah, I interviewed at IU University. I knew some surgeons who lived in Carmel, Indiana, and it just turned out that wasn't a good fit for me. That was an academic job. I really wanted to go into private practice, and so I decided to go for a private practice position. Best restaurants in DC. There's some really good ones. There's a really good Indian restaurant called Rasika. If you like Indian food, I would definitely check that out. Try to go to a couple different new restaurants every so often. The thing is, I got spoiled living in New York for 5 years with the food. So like the food everywhere else, you could go to a different restaurant in New York. There's like 20,000 restaurants for like 10 years and still never get to all the restaurants. So I got a little spoiled with food in New York, and so the other places I'm like, oh, the food's never as good. Like I can't eat pizza anywhere else because I ate $1 pizza or a really good pizza in New York. So I recently fractured my knee. I have a splint right now, but my other leg I used to have pain in the same area. I'm afraid that will fracture too. Should I do an x-ray to see if it's the same? If you're just fracturing your knee from not doing very much, I would worry about osteoporosis, bone density. It may be helpful to get a DEXA scan. Maybe helpful to check your vitamin D levels, your thyroid levels, your parathyroid levels, calcium levels. Make sure none of that's low. Why are you getting fractures all the time would be the question to answer. How can we find a doctor who has experience with osteonecrosis? I would probably find a fellowship-trained hip and knee surgeon. Any fellowship-trained hip and knee surgeon is going to do avascular necrosis, osteonecrosis surgery. I do a lot of joint replacements for osteonecrosis, and so just find someone who's fellowship-trained joint replacement and who has a little bit of a reputation, and that should be good. But I appreciate all the questions on the stream. Thoughts on steroid injections for nerve pain? Does it work? Yes. So in the back, cortisone injections can be very helpful for calming down the nerves. I appreciate all the follows, all the support for the channel. We've been really growing. The videos have been ramping up these last couple days. So I appreciate all the support. I'm gonna try and do these more often throughout the week. But I hope everyone has a great night.